Sonography by Joseph Jameson. Why apply? Hello, I am Joseph Jameson, and I am personally interested in sonography, more specifically, becoming a registered diagnostic cardiac sonographer. My interest started early because of my heart has been monitored every few years for possible early diagnosis of cardiomyopathy. Because of this, I had an early interest in heart structures, and that led to a general interest in anatomy as a whole. I have multiple family members who are in the medical field too, and wearing a white coat is always a bonus. Requirements and certifications 2 years. Prereqs include anatomy, physics, and clinical externship. The next step will be to pass the HESI exam to be enrolled in an ARDMS accredited program. State certification for the registered diagnostics cardiac sonography requires the passing of the SPI exam and the corresponding specialty exam. Careers. There are many career paths you could take with an associate's degree in diagnostics medical sonography, including cardiac sonography, which view images of the heart, abdominal sonography, which view images of the abdomen, including the liver, pancreas, and spleen, mammography, which is the medical imaging of the breast, and vascular techs, who specialize in the medical imaging of blood vessels, including veins, arteries, and capillaries. Operations/procedures. Sonography can be used to assist during surgical procedures such as a lumpectomy or removing cancerous cells from the breast. Salary outlook. The average salary of a clinical registered cardiac sonographer in Tennessee is $81,364, with an 8% growth over the next decade. Salary depends on location as well. For example, the salaries vary between outcare centers and hospitals. While hospitals are generally more fast-paced, working in them typically give more comprehensive benefits. Sonography history. Ian Donald produced the first diagnostic image of the body, an image of a fetus's head, in 1965. Real-time scanners were introduced by companies like Aoka and Christianik. These were later replaced by multi-element linear array and phased array scans in the 1970s. The real-time traversal probe was introduced, which led to the rapid advance in gynecological scanning in the 1980s. ARDMS accredited schools. ARDMS accredited schools in Tennessee include South College, Chattanooga State, and the University of Memphis. MRI. Why apply? Like registered cardiac sonographers, MRI techs can choose to occupy a clinic or a hospital. MRI techs have a projected job growth of 6% over the next decade, and MRI techs are also provided with numerous travel opportunities. Requirements and certifications 2 years. Prereqs include chemistry, physics, anatomy, biology, and math. The next step would be to enroll in an ARRT program. MRI techs in Tennessee must pass the MRI exams to be officially licensed. With the state license and enough clinical hours, you will be a certified MRI technician. Modalities. There are two career paths you can take with an MRI state license. An MRI technologist, they use magnetic fields to produce images of the internal body, or the chief MRI technologist, who oversee MRI images and reassure quality scans. Operations and procedures. MRI can be used to assist with brain surgery by getting a clear, more defined image and helps with craniotomy or removal of cancerous cells from the brain. Salary outlook. The average MRI technologist salary is $101,097 in Tennessee. Job benefits include a flexible schedule and a good job security. MRI history. The 1950s. Research in nuclear magnetic resonance, electromagnetics, and biophysics, biochemistry, and computer engineering began. 1969. Raymond Damadian, a physician at SUNY Brooklyn, proposed an MRI body scanner after discovering that NMR could distinguish between healthy and cancerous tissues. 1971. Paul Lutenberg, a chemistry professor at Stony Brook, combined magnetic fields granites with back projections to create the first MR images. 1972, Damon and Field filmed the first MRI patient. JRCERT accredited schools. JRCERT accredited schools in Tennessee include South College and the University of Tennessee Medical Center. Nuclear medicine. Why apply? Nuclear medicine technologists can work in various locations such as hospitals, universities, and medical clinics, imaging clinics, diagnostic labs, and research centers, typically more hands-on and intimate with patients. Requirements and certifications. Just like MRI techs, prereqs include chemistry, physics, anatomy, biology, and math. The next step would be to enroll in a nuclear medicine technology program. Nuclear medicine techs must also be certified in the state of Tennessee. Operations and procedures. Nuclear medicine techs can be helped to diagnose help to diagnose diseases before it reaches a critical stage. For example, the early detection of skin cancer. Salary outlook. The average salary of a nuclear medicine tech in Tennessee is $97,990. Projected job growth over the next decade is surprisingly declining by 1%. Nuclear medicine history. Early discoveries in 1896, radioactivity was discovered by Mary Curie and made contributions to the field. First medical use was in 1930 when radioactive isotopes were used for the first time in medicine. Radioactive phosphorus. In the early 20th century, Ernest Lawrence created a device to generate radioactive material, which his brother John used to treat leukemia. Nuclear medicine programs. Baptist Health Science University and Austin Perry State University, Chattanooga State Community College, and South College all offer their own open nuclear medicine programs. Sources: ARDMS, Registered Diagnostics, Cardiac Sonographer, Cambridge Prerequisites Needed for Sonography Program, College Mayo, What Does a Diagnostics Medical Sonographer Do, and a Brief History of Sonography. Healthcare Pathway, How to Become an MRI Tech, Avid Health MRI certification, ZipRecruiter MRI tech salary, and MRI image living tissue. The Journal of Nuclear Medicine, College Mayo Nuclear Medicine Technology, ZipRecruiter Nuclear Medicine Tech Salary, and the